Hello and welcome to today's important discussion on a critical aspect of our well-being: heart health. Understanding and recognizing the early warning signs of a heart attack can be life-saving. Heart attacks occur when the blood supply to the heart is suddenly blocked, severely threatening life and health. Globally, heart attacks are a leading cause of death with a significant impact, especially in the USA, where they contribute to a high mortality rate among both men and women. Many of us might not consider the seriousness of the symptoms because they often resemble less critical conditions. Today, we'll delve into those symptoms that might be easily overlooked in our daily routines but are actually cries for help from our bodies. Recognizing these signs early isn't just about medical intervention. It's about changing the narrative of our health journey and taking proactive steps towards longevity. We'll explore each sign in detail so you can relate them to experiences you or your loved ones might face. This isn't just information, it's a crucial toolkit for life. Stay tuned as we equip you with knowledge and actions to protect your heart and ensure a healthier future. Sign number 1, unusual fatigue. Unusual fatigue, when you feel overwhelmingly tired without a clear or justified reason, can be one of the earliest and subtlest warning signs of an impending heart attack. This type of fatigue is different from the usual tiredness we feel after a long day or less sleep than usual. It's more profound and doesn't seem to improve with rest. When the heart is not functioning optimally due to narrowing or blockages in the arteries that supply blood to the heart, it has to work harder to pump blood throughout the body. This increased effort can drain your energy levels, leaving you feeling unusually exhausted. It's not the type of fatigue that hits after physical or mental activity. Rather, it's constant and persistent, even when you've had ample rest or haven't engaged in strenuous activities. It's important to recognize this symptom, especially because it can easily be brushed off as a result of stress or a busy lifestyle. However, when this fatigue is accompanied by other symptoms like shortness of breath, sleep disturbances, or chest discomfort, it becomes crucial to consider a cardiovascular cause. Understanding and acknowledging this sign can lead to early diagnosis and management, potentially preventing a full-blown heart attack. If you or someone you know is experiencing this kind of unexplained, persistent fatigue, it's advisable to consult a healthcare professional. Early intervention can make a significant difference in outcomes and can be crucial in preventing serious heart complications. Sign number 2, sleep disturbances. Sleep disturbances or changes in sleep patterns can be more than just minor annoyances. They are often significant indicators linked to heart health. Disrupted sleep, especially when it becomes a consistent pattern, might signal underlying cardiovascular issues, including the risk of a heart attack. The heart and sleep are closely connected through various physiological pathways. During normal sleep, blood pressure and heart rate typically decrease as part of the body's recovery and repair processes. However, if sleep is frequently disrupted, this natural decline in nighttime blood pressure doesn't occur as it should, which can increase the strain on the heart. Additionally, poor sleep has been associated with the worsening of other risk factors for heart disease, such as increased inflammation, higher stress hormone levels, and glucose metabolism disturbances. Specific sleep disorders like sleep apnea, where breathing stops intermittently during the night, directly stress the heart by causing sudden drops in oxygen levels. This forces the heart to work harder, leading to increases in blood pressure and heart rate, which over time can weaken the heart and lead to heart attacks. If you find yourself waking up frequently during the night, struggling to fall asleep, or feeling unusually tired after a full night's sleep, it's essential to consider these symptoms seriously. Consulting with a healthcare provider to assess heart health and possibly evaluate sleep quality through a sleep study can provide critical insights and preventative care. Addressing sleep disturbances not only improves overall well-being but may also reduce the risk of heart disease and prevent potential heart attacks. Sign number 3, shortness of breath. Shortness of breath, medically known as dyspnea, can be a critical early warning sign of an impending heart attack, especially when it occurs unexpectedly during low levels of exertion. This symptom arises when the heart struggles to pump enough blood to meet the body's needs, leading to inefficient oxygen exchange in the lungs. In the context of heart health, shortness of breath is often a sign of heart failure, cardiac ischemia, reduced blood flow to the heart muscle, or an impending heart attack. These conditions can result from underlying issues such as blocked arteries or weakened heart muscles. When the heart cannot pump effectively, fluid can back up into the lungs, causing congestion and difficulty breathing. This is why even minimal physical activities like walking up a flight of stairs or carrying light objects might leave someone feeling out of breath, despite having no respiratory conditions like asthma or chronic obstructive pulmonary disease, COPD. If you or someone you know experiences sudden or unexplained shortness of breath, particularly if it's accompanied by other symptoms such as chest discomfort, fatigue, or swelling in the legs and feet. It is crucial to seek medical attention immediately. This symptom should not be dismissed as merely a sign of aging or poor fitness, especially if it develops abruptly or worsens rapidly. Recognizing and responding to unexplained shortness of breath can be life-saving, as timely medical intervention can prevent a heart attack or address other serious cardiovascular conditions effectively. Sign number 4, indigestion, nausea, or stomach pain. Indigestion, nausea, or stomach pain are often dismissed as minor digestive disturbances or attributed to less serious conditions like acid reflux, gastroenteritis, or food intolerance. However, it's crucial to recognize that these symptoms might not always stem from digestive issues alone. They could also be indicators of heart-related problems, including a heart attack. When the heart experiences distress, particularly during a heart attack, the pain and discomfort may not be limited to the chest area. Due to shared nerve pathways, pain signals from the heart can instead be felt in the stomach or other parts of the upper abdomen. This phenomenon, known as referred pain, can lead individuals to mistake a serious heart condition for something benign like a stomach upset. Additionally, the body's response to cardiac distress can include the activation of the vagus nerve, which not only affects heart rate but also has branches that extend to the gastrointestinal tract. Activation of this nerve can cause feelings of nausea, bouts of indigestion, or an overall sense of abdominal discomfort. These symptoms are particularly concerning if they occur in conjunction with other heart attack signs such as chest pain, shortness of breath, cold sweat, or lightheadedness. It's important for anyone experiencing these gastrointestinal symptoms unexpectedly, especially if they don't have a history of digestive issues, to consider the possibility of a heart condition and seek immediate medical evaluation. Recognizing that these symptoms could be heart-related may lead to earlier diagnosis and treatment, potentially saving lives. Sign number 5, increased anxiety. Increased anxiety can sometimes be more than a psychological issue. It can also indicate potential heart problems, including an impending heart attack. While anxiety is commonly understood within the context of mental health, its physical effects, particularly on the heart, are significant and often overlooked. The connection between increased anxiety and heart health is multifaceted. First, anxiety can lead to an increase in stress hormones like adrenaline and cortisol. These hormones prepare the body for a fight or flight response by increasing heart rate and blood pressure, which over time can put excessive strain on the cardiovascular system. This heightened state can exacerbate existing heart conditions or even precipitate new cardiac issues, such as heart rhythm abnormalities or increased plaque buildup in the arteries due to elevated blood pressure. Moreover, the physical symptoms of anxiety, such as palpitations, chest tightness, and shortness of breath, can mimic those of a heart attack. This overlap often makes it challenging to distinguish between anxiety-related discomfort and actual cardiac distress, leading to either underestimation of serious heart conditions or unnecessary panic over benign anxiety symptoms. It's also important to note that chronic anxiety can contribute to other unhealthy behaviors such as poor diet, smoking, or a sedentary lifestyle, which are risk factors for heart disease. Therefore, if someone experiences a sudden increase in anxiety, especially if it's accompanied by other symptoms like those mentioned above, they should seek medical advice to determine whether the cause is psychological, cardiac, or a combination of both. Addressing anxiety and its potential link to heart problems can help manage both mental and cardiovascular health more effectively. Sign number 6, jaw or throat pain. Pain in the jaw or throat might often be misinterpreted as something related to dental health or a throat infection. However, it's important to recognize that these symptoms can also be related to heart issues, specifically heart attacks. This type of pain is known as referred pain, which occurs when a problem in one part of the body causes pain in another part. The connection between jaw or throat pain and heart issues stems from the way the body's nervous system is wired. The heart and these areas share some of the same nerve pathways. During a heart attack, when the heart is deprived of oxygen due to blocked blood flow, the body may send pain signals through these shared pathways. This can lead to experiencing pain in areas like the jaw or throat, even though the source of the pain is actually the heart. This symptom is particularly significant if it appears suddenly, feels unusual, or occurs in conjunction with other symptoms of a heart attack, such as chest pain, shortness of breath, sweating, nausea, or lightheadedness. It's especially prevalent in women who may experience these less typical symptoms more frequently than men during a heart attack. It's crucial for anyone experiencing unexplained or sudden jaw or throat pain to not dismiss it as just a dental or throat issue, especially if the pain is persistent or accompanied by other signs of a heart attack. Seeking immediate medical evaluation can be critical, as timely diagnosis and treatment can significantly improve outcomes in cases of heart-related problems. Sign number 7, sweating unusually. Unusually excessive sweating, especially when it occurs without a clear reason or during times of inactivity, can be a concerning and often overlooked symptom of heart problems, including a heart attack. This type of sweating, known medically as diaphoresis, can happen independently of any physical exertion or external heat and can be an early warning sign of cardiovascular distress. The underlying mechanism involves the body's autonomic nervous system, which controls involuntary actions, including the heartbeat and the regulation of body temperature. When the heart is under stress, such as during a blockage that leads to a heart attack, the body's response is to increase sympathetic nervous system activity. This heightened response not only increases heart rate and blood pressure, but can also trigger excessive sweating. This physiological reaction is the body's way of trying to maintain normal operation despite the cardiovascular crisis. Diaphoresis is particularly noteworthy when it occurs alongside other symptoms of a heart attack, such as chest pain, shortness of breath, nausea, or feelings of dizziness or lightheadedness. It's a symptom that should not be ignored, as it can often occur before more recognizable symptoms like chest discomfort become apparent. If someone experiences sudden, unusual sweating with or without additional symptoms, it is crucial to consider it as a potential sign of a heart attack and seek immediate medical attention. Recognizing and responding to this symptom promptly can be crucial in the effective treatment of heart issues and can significantly improve survival rates. Thank you for watching our video on the early warning signs of a heart attack. Recognizing these signs can be the key to preventing serious heart issues and saving lives. If you've experienced any of these symptoms, please don't hesitate to consult a healthcare professional. Your health is invaluable, and being proactive is your best defense. If you found this information helpful, please like this video and subscribe to our channel for more insightful health content. By staying informed, you're taking an important step towards a healthier life. Remember, awareness is power. Take care of your heart, and it will take care of you.